In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear a nurse talking to her colleague about a patient's request to leave the ward. Now read the question.
Mr. Jenkins really shouldn't be going anywhere at the moment.
Well, it's only to the coffee shop downstairs, and he's mobile, so...
He can certainly do minor things like showering and getting back and forth to the toilet by himself, but that doesn't necessarily mean he's up to leaving the ward.
He's going a little stir-crazy, and he's been on the ward now for weeks. He needs to feel like a normal person again.
Of course he does, but we can't jeopardize his safety. I realize he believes he can, but I really think it's beyond his capability right now.
I'm happy to go with him if it'll ease your mind.
I'd really prefer if he just holds off until he gets the tick of approval. We don't want him undoing all the effort for a cup of coffee.
You hear a paramedic briefing a doctor on a recent emergency admission. Now read the question.
Mr. Tegan has suffered suspected second-degree burns from boiling oil to the back of both hands and forearms. He works as an apprentice chef and was lifting a pot of oil when he slipped, inadvertently scalding himself. Apparently he panicked and his co-workers were forced to hold his arms under cool running water until we arrived at the scene. They also managed to contact his wife, who's on her way. You may appreciate her assistance as he's very distressed and obviously frightened. My colleague has managed to administer oxygen and gave 2.5 milligrams of morphine, but that was as far as he got, as Mr. Tegan continued to put up quite a struggle en route, which is something you'll need to consider before any further treatment. Pain is well controlled at present.
You hear an anaesthetist talking with a patient prior to her surgery. Now read the question.
So, Mrs. Simpson, do you have any questions before we go into the theatre?
I'm sorry, I think I'm just a little nervous. Everything you told me earlier has gone in one ear and out the other.
I see, it's perfectly normal to be anxious before major surgery.
Well, if I'm going to be under for such a long time, it just worries me that anything could happen. I know there are dangers involved with it, and I think I'm prepared for that, but how will it leave me feeling? I mean, I'm really not looking forward to it. It's going to be a lot of rehab and really training myself to walk again. I'm just not sure if I'm up to the challenge. How can I possibly go through all of that when I'm in such agony? It just doesn't seem possible. It's such a long process.
You hear a trainee doctor telling her supervisor about an uncomfortable situation she recently encountered with an end-of-life patient. Now read the question.
Would you mind if we talk about Mr. Harris in bed 6?
Sure. Is there a problem?
No, nothing like that. The ICU nurse asked me to talk with the patient's family about his situation. I mean, basically explain to them that there's nothing else we can really do for him and that he likely won't survive.
How did it go?
Horribly. They were asking what they should do next, what steps to take. I could barely keep myself together. It was just so hard to talk with them just staring at me like that, with such blank expressions. It was the hardest thing I've ever encountered. I honestly don't think I'm cut out for situations like that.
I assure you, it's perfectly normal in such a predicament.
You hear a nurse briefing a colleague at the end of her shift. Now read the question.
So in bed 5 is Mr. Benjamin Higgins, 75 years of age, under Dr. Munro. He had elective angioplasty and insertion of stent via the left femoral artery this morning at 9 a.m. He has a history of hypertension, hypercholesterolemia and angina. His medications are metoprolol twice a day, simvastatin and glycerol trinitrate single spray. He has no known allergies. With regards to the operation, there were no complications and he returned to the ward today at 11:30 a.m.
Did he have any pain at all?
He did, just 3 out of 10, mild discomfort. I tried to call Dr. Munro, but he was in theatre. But his secretary said she'll pass it on. He has to remain supine until 5 p.m. today, and his wife will have to be informed of his progress. When I received him, he was alert and orientated, and his vitals were within normal range. ECG is normal sinus rhythm, and that was at 11:45.
You hear a veterinarian and the owner of a cat discussing how to give insulin to her pet. Now read the question.
So I'll just explain a little on the initial steps of administering the insulin.
Okay.
It's really very simple. So the first thing is the insulin needs to stay in the refrigerator. Now Felix is getting 2 units, twice per day. So what I suggest is marking it on a calendar for each day. So divide the day in half with a line. I'd recommend drawing a little box in each section so you can give it a big tick for both morning and evening doses. The one thing you don't want to do is double dose the insulin. So you turn the bottle upside down and roll it gently, don't shake it, and then take out the syringe.
What happens if you shake it?
I could potentially destroy it, so you want to try to avoid that.
Okay, sure.